What do you expect from the budget on healthcare this time around?
So I think that our expectations are of an overall economy continuing to grow, continuing to be a global leader. We need resilience. There are multiple uncertainties, and India's growth rate at 6.5 to 7% is a critical factor for us to sustain. And why I believe the macroeconomic first and then specifics for healthcare. So we need to continue the growth path, whether it's expenditure in the capital expenditure, enhancements of the manufacturing thrust that had been there. So PLI schemes have been fairly successful. Can we expand the number of sectors in the PLI scheme? I also believe it's very important for us to look at streamlining of the overall economy. So, ease of doing business. I think India was at number 71. We've moved up to number 63. Can we come in the top 50? The advantage of that is really an overall productivity gain. So, transport, which is critical to reduce our logistics costs. So, the overall economic development is first to be continuously prioritized, as has been. So let us continue the innovative steps. That leads me really to innovation. And I think in innovation, it's critical for us to really understand where the puck is going in the world. And there are significant enhancements, advancements, and modifications happening because of technology.
Right.
India has the truly enviable position. We've created the digital health stack. We have the brain power to do it. Let's take the next jump in quantum computing and AI, etc. So that I think is one big piece on the innovation side.
Right.
Moving further and really looking at what can we do next, besides I spoke of ease of doing business, is really to look at private sector led growth even further and look at creating a more enabling environment for the private sector investment, whether it's in land, in labor, in capital market reforms. All these reforms are critical to get private sector
Right.
further interested.
So, touching upon two things that you mentioned, firstly, on innovation and emerging tech. So, is there any specific allocations that you would like to see?
So 100%, I think that I would like to see the research write-off, which was there for corporates, for innovation-led aspects in research, especially in the healthcare field. I think new drug discoveries, new diagnostic discoveries. I mean, there are multiple things of early stage cancer detection using blood. It's mRNA sequencing and it's miRNA sequencing and multiple other new areas. So if we could find cancer in its early stage, we would be able to prevent a full-blown incidence. We would be able to cure it much more easily. So that is a big area. Genetic testing, because once we know the gene profile, we'll be able to be more proactive in terms of disease presentation. So that's another significant one. Also, I think it's very important to keep the overall health allocation in mind. At 1.9 or 2% of the GDP, this is an inadequate allocation, and I look for more, spending to enhance and improve and equip our primary healthcare centers, create, adequate learning environments, and put quantum computing into healthcare. Uh, these are the type of bold moves that we would love to see. And also in healthcare, a significant stimulus should be given to medical value travel because Heal in India is a concept whose time has come. India delivers world-class healthcare at 1/10 of global prices. We need incentivization of this so that the medical value travel or the Indian healthcare sector can grow and continue to not just treat international patients, earn foreign exchange, but also earn global goodwill. And so I would really look forward to a very special announcement or proclamation on the concept of Heal in India.
Okay. Medical tourism will be one of the aspects that you'll look out for. Coming.
So actually, if I may say, I think Heal in India encompasses medical tourism, health tourism, like Ayurveda. And heal could also be spiritual, and that's happening right now with the Kumbh Mela.
Right.
So it's a 360-degree healing. But medical tourism is very, very important.
More ways of looking at it than one way. So, ma'am, you also spoke about women and healthcare. Is it about ensuring that the workforce that we have, or the medical practitioners that we have, there are more incentives to have more women in it? Because one of the angles which comes up when we talk about that is, of course, safety. And last year, we saw the pan-India protests in a way that were held for doctors actually seeking more safety, seeking better SOP in terms of ensuring more safety for doctors working at hospitals. So in terms of the budget, what kind of incentives, if we just narrow it down to women, would you like to see?
So I believe women at an overall level need to be incentivized. We must improve our, labor force participation from women. I'm glad that it's crept up to 24%, but we do need this to be higher. With specific reference to this, there's a range of things. The Indian care economy needs to be developed so that when women go to work, they are able to safely leave their children somewhere. And when the elderly are at home, it is almost automatically assumed that women may stop working because they need to take care of the elderly people at home. So the care economy is a significant aspect. I think equal wages, opportunities for growth and positions in leadership, enforcement of all the regulation related to women on boards. Each one of these are steps which have either been conceived or discussed. I look forward to them being accelerated and enhanced. Honestly, the number of women doctors who are graduating is quite significant, so I'm not looking for any further incentive on that. And the nursing number is, of course, more on the women's side. But what would be good and what is important is for us to ensure that women are able to progress in their careers, especially in the healthcare field.
Right. Another important thing that, a lot of viewers would be interested in, and we'll look out for that on 1st of February, is when it comes to health insurance and the expansion of it that the government might be planning. Do you think it's time for the center to scale up on its ambitious Ayushman Bharat scheme? There's already, of course, a lot that they have done, but what can we expect on that front?
So I think we need to give a lot of credit to the government for Ayushman Bharat. The current coverage of almost 55% of the population is significant, and it's truly commendable. Not only that, I think the data capture and the back-end infrastructure created for it is also significant. There clearly needs to be a rationalization of the pricing concept, but that is work under progress. The big move I look forward in insurance is a mechanism to move from Ayushman Bharat, which is for the lower socioeconomic strata, and find a way with some copay or some payment for a new insurance layer for middle income or lower middle income. The second very, very important aspect is to find a way to cover outpatient treatment, because in India right now, all our insurance programs are related to inpatient care. But outpatient or primary health care is one of the significant areas which, when ignored, neglected, or handled inadequately, leads to more disease burden. And therefore, I look forward to a big scheme on outpatient insurance or a mechanism to enable access to outpatient care. Further, one of the important aspects for healthcare is research. So how can we bring in tax incentives on research? Another critical factor is enabling the high-end healthcare that is available in the large cities to also move into tier 2 and tier 3 cities. I believe it is appropriate to request for tax incentives as well as subsidies on hospitals coming up in tier 2 and tier 3 cities.